First thing you learn as an injector is to not go too low on the forehead. Okay, so we're always encouraged to leave 1 to 2 centimeters distance above the brow. And what this will do is reduce the risk of us paralyzing the lower fibers, what we call the inferolateral or the inferomedial fibers of the frontalis muscle. As a result, that will stop that heaviness. So something you're never going to do as an injector, you are never going to inject in here, and you're never going to inject in here. That is what we call the danger zone, and it's usually the first thing people learn on a course. You're also not going to inject into these inferomedial fibers of the frontalis, okay? Because if we relax these, you're going to cause medial heaviness. What else are we going to do and what are we not going to do? When we inject the frontalis muscle, we are not going to inject deep. If your needle ever touches bone, you've gone too deep and you do not want to place toxin there. By injecting toxin beneath the muscle, we risk the toxin trickling down your bone and diffusing to areas we do not want it to affect. So it's safer to stay more superficial than too deep. But if you feel confident, an injection depth of around 2 to 3 millimeters is perfect in most people to hit the muscle belly. What we're also going to do is ensure we do our best to provide even distribution of toxin across the whole frontalis muscle. By doing that, we reduce the risk of any asymmetries at 2-week review. We're also going to reduce the risk of any excess muscular contraction. For example, ladder lines, where you've got excess pull in the corners. Okay, now we've discussed what to do and what not to do, let's discuss some of the most popular treatment approaches for the frontalis. And yes, before people come at me and say, oh, but everyone's different. Yes, everyone is different and you have to treat the individual in front of you. However, there are a number of standard treatment protocols which can yield good results for most people. But yes, always treat the person in front of you. If you notice someone has a slightly stronger right side, obviously put slightly more on that side.